meta-analysis to look at a wide range of disorders that CBT is used to treat. CBT has had more research than any other methods, and more studies are needed to get better results. The article looked at depression, anxiety, panic disorder, social phobias, PTSD, schizophrenia, bulimia, and some others. The treatment of CBT has shown positive long-term results for depression, anxiety, panic disorders, and social disorders. Bipolar shows less relapse compared to medication alone. CBT has been used with obsessive compulsive disorder and is showing evidence of being as effective as ERP for this disorder. Social phobias show positive results still after 5 years. More studies are needed in this area too, on short terms. Panic disorders, CBT shows less slippage after a year compared to using just pharmacological treatments. Combining them could be a possible good method. Anxiety disorders, future studies will help, but it does seem that CBT treatment's effects were stable after 6 months, and other trials suggest even after 8 to 10 years. Depression, severely depressed clients show benefits from CBT and medications in combinations, especially for those who are severely depressed. CBT along with their medications can help them a lot more than just medication alone. Schizophrenia patients show improvement with CBT in helping with less stress because of delusions, hallucinations, those kind of things, and help them to cope better along with medications, because a lot of times they do stop taking medications. So at least if they have a better coping skill, it's helpful. Bipolar clients show less relapse compared to medications only when they use the CBT and skills in combination with their medications. They too tend to self-medicate or discontinue medications and then end up with more issues. The article used 16 meta-analysis comparing the 16 disorders. The report points that since CBT involves changing dysfunctional thinking and beliefs, the learning of new skills that are used in daily life helps them to maintain long-term effects of CBT. The use of CBT seems that it does help. The degree it helps needs to be studied more. Improvements with CBT in combination with medications seems to be something that a lot of counselors and doctors are using to help a lot of clients now, especially with coping. The article shows that in some areas they need more studies to give a better accuracy on how much exactly CBT is helping clients. The exact impact it may have on the disorders that it does claim to treat. This paper was lacking in short-term results for several areas, like the depression and anxiety disorders or panic disorders and such. Some of them are positive, but they just don't have enough studies yet to know for sure how CBT is actually playing a part in their treatments. But overall, I think CBT may be something that should be used in combinations for patients that have chronic or long-lasting mental illnesses like schizophrenia and bipolar. If they can learn some coping mechanisms for when they aren't using their medications properly, it could be very helpful to them and essential mechanisms for them to deal with life.